Hi, pleasure to be here with Francis Kakumba, who is the Chief Executive of the African Health Policy Network. Just wanted to stop by to talk to you a little about you, the charity and your work. So you're a charity that is dealing with health concerns of people of African descent living in the UK.
Yes.
Why is there a need for a charity? Why is the need for a charity for that group? Yeah.
Well, Africans are one of the fastest growing communities in the UK. If you look at the latest census data that came out in 2011, you'd find that Africans since 2001 have almost doubled in terms of size.
Right.
So, but also, if we look at health inequalities in conditions such as HIV, diabetes, stroke, cancer, mental health, you tend to see a poorer health outcome for African communities across the board.
And when you say a poorer health outcome, what does that mean? Are you saying that they're? I think that you were telling me a little bit earlier that I think people of African descent are disproportionately affected by things like HIV.
Yes.
And I guess that we know with things like diabetes that there are and the high rates of errors. When you say that the poorer health outcomes, what do you mean? What does that actually mean? Because I'm keen to unpack that. Does that mean that the services doesn't reflect them? Does it mean that they're more likely to have recurring health problems? What does that poorer health outcomes mean?
Yeah, I mean both of those things. I think you have a situation where there are certain lifestyle related factors that tend to create a condition. Tend to make it harder for certain communities to access services sooner. So, for example, we find in lots of the research that we've carried out that immigration plays a huge role in being prohibiting people from accessing primary care services. The fact that people are being dispersed across the UK to various parts of the country where they do not have the local knowledge and access to and awareness of local services, and they find it difficult to go for those preventative services. Also, in addition to that, you find that there are certain cultural and traditional beliefs that sometimes do not synchronise with the current health system as it stands.
Is that in terms of lifestyle, what kind of diet people are eating, or is that in terms of whether people are just far more likely to take care of their health care themselves or not to present to doctors?
Yes, both beliefs, the fact that sometimes people have strong entrenched beliefs, for example around maternal care. We've recently done some research in Enfield where we've looked at why is it that African women tend to report late in childbirth, and many of the women that we interviewed spoke about beliefs that actually being open and disclosing your pregnancy before 3 months would jinx the whole process. And so and this is a link to beliefs around the evil eye and so on and so forth. So we know that there is a very important role that traditional beliefs play in shaping how people make health decisions.
So there's cultural factors, there's lifestyle factors and all this kind of stuff. So how is that charity, how do you begin to address those kind of things? Especially, I mean, it seems as though as a society we've got a hard enough job sometimes in terms of getting certain people to make certain certain changes when it comes to, let's say, what we're eating and what we're drinking, or whether we're doing enough exercise anyway. And when you add on to that some of the other factors and the other kind of barriers that you're talking about, it sounds as though there's a huge job that an organisation like yours has got to do. And where do we begin, and where is the I don't know, not necessarily responsibility, but if anybody's watching this, what are the things that we should be doing, and what are the things that you're keen to see happen at all levels, from policy level in terms of practice and people in their everyday lives? I know it's a big question, but
no, it's a huge question. But one of the things that we've looked at to help to address that question and to make to frame our thinking in tackling those complex issues is by looking at it at various levels. We understand that on a structural level. So structurally, what we mean by structurally, look at we're talking about the systems in which government and statutory sector plays. There is a role there for services, for decision makers, for commissioners, etc., for for the way that systems are designed. There is a role there to ensure those systems are not in any way, shape or form prohibiting African people from accessing them, and that are culturally sensitive, and are aware of these communities, and are targeting their services to meet their needs.
So, for example, I'd mention that on the same way that in some areas where we've been mindful that people might have different backgrounds, and where people have done things like kind of translation or whatever, or making up things, we need to, whatever the relevant means that it's going to make it far more easy to access and to engage with those particular communities. That's there.
Yes.
Yeah.
Yes, and I think I think once you have these services, when you have services that are welcoming, that are accessible, and that are relevant to the individual's needs, you tend to have better health outcomes. And so that's at one level, but there are also other levels of intervention, and also on a community level. We need to start to open up debates and discussions about some of our beliefs and about some of our entrenched.
And where is that can take place? I mean, I guess this is one of the challenges. Where is this in terms of if there are small community groups of people, if they're religious in certain in churches or whatever, or where in the local people in their own homes? What kind of stuff is that you'd like to see?
The good thing about working in this sector, working with African communities and within a diaspora, is that you tend to find that these communities congregate, and are using that religious term. So yes, you go to places where the communities meet. So for example, church settings, for example, barber shops, for example, taxi rags, etc. Places, interfaces where African communities tend to congregate and to meet other Africans, restaurants and so on and so forth. And we believe that it's those people, those agents of change at that level, who have a very powerful role in disseminating messages and also framing people's beliefs as well.
Right.
But now, we know in our digital age, there is a whole new platform, a whole online platform for us to be engaging with people. We're aware of trends within the social media field, but we're also aware of trends in terms of how people use and interact with a mobile phone within Africa. We're aware of some of the amazing advancements that we're seeing on the continent that people are bringing over here. Right.
So you're saying that actually it sounds as though it needs to be far more kind of creative and engaging with that. So from everywhere, from the church, be it the barbershop, how ways of engaging with those people, other ways of using social media, and I guess that you're saying it's a two-way thing. There's a work that you, I guess, that as an organisation are doing, and then encouraging those people who already are people of influence to be mindful of some of these issues and bringing those into play, be it it's a church, it's a community centre, or if they happen to be a health service. Yes. Just before we close, if you had a shopping list of just one or two things that you would like to see happen, what would those things be? Or perhaps just one thing that you talked about on the structural level, if there's a message for policymakers and if there's a message for, let's say, members of the public who are watching this, what would your message to a policymaker be, and what would your message be to members of the public? And you might even pick within that whole policy context.
Well, the message to the policymaker is that in times of austerity and in these lean times, great impacts and savings can be made through targeting your initiatives. And sometimes, it does make sense to take risks. I think a lot of people who are in this sector at the moment are nervous and are feeling scared to take to think outside the box and to try new things. But I think there's no better time to actually look for new approaches and to learn new ideas.
Right. So I think
this links to the point I wanted to make about what in terms of the point I'd like to point towards communities and individuals is actually this is the most unique opportunity for individuals to play a greater role in public life in general. We are now in an era, post-Leveson era, where we're seeing the whole relationship of the state and the media, the lawyers, the previous forms of institutions, they are being challenged a bit by this new focus of the individual. And we believe in the individual's connectedness and their ability to collectivize as a very powerful force. And I think as a community within the diaspora, we have a new network and a new opportunity to interact using digital networks across, physical, geographical boundaries, to connect with people on an interest level to address these issues. Right. So we're gonna, we promote that spirit of Ubuntu, of people collectivizing and sharing each other's strengths and knowledge to actually combine to be greater than the sum of our individual parts.
And that sounds quite exciting and quite encouraging, and turning from problem to solution, because it sounds so, what you're saying is that actually, whilst there's huge challenges, there's huge amounts of information out there, and they're at all different levels along the thing, from the individuals, from people who happen to be running groups and so on, through to a government level. There's all stuff we could play. We just need to be a little bit more imaginative and bold and forward-looking and responsive in terms of using those things and that particular technology to engage and share. And you're saying that actually individuals now are really in a strong place to be doing that. Well, looking forward to more of the work, and thank you very much for taking time. I know you've got a very, very busy schedule. Thank you very much for taking time to speak to me. I'm just going to leave you to smile as I turn off the camera, and thanks very much for your time again.
Thank you.
Thank you.
Yes, thanks a lot.